After high-risk patients leave the hospital, they are most vulnerable to complications in the first few days. The goal of UC San Diego Health's virtual care clinic is to prevent avoidable readmissions.
The real benefit for me relates to geography.
Bob Lagomarcino lives in Sacramento. He traveled to San Diego for a specialized procedure. Instead of an extra trip, he was able to follow up with his doctor virtually.
I appealed to her a few times following discharge to say, hey, can you help me sort out this confusion concerning medication or next steps in my treatment?
Dr. Sarah Horman was able to make sure his prescriptions were filled at his home pharmacy. She says it helped him avoid going back to the hospital unnecessarily. It's part of UC San Diego Health's process for making sure a patient's primary physician and caregiver understand their care plan.
So this is a video visit with one of our hospitalists, and our goal is to see the patients within a week of discharge.
In a recent study, Horman and her colleagues found high-risk patients like Lagomarcino, who followed up virtually, were readmitted less often.
Readmission rates for patients that we see are anywhere between 20 and 30% lower than patients that we don't see.
The transition clinic started during the COVID-19 pandemic to address barriers to in-person care.
So I've seen patients in homeless shelters. I've seen patients in drug rehab centers. Sometimes they go home to a family member's house. Sometimes they don't even live in San Diego.
She says hospital data show when checkups after surgery are in person, as many as half of patients don't show up. That number drops to less than 5% at UC San Diego's virtual clinic.
So really, when you think about health equity and meeting our most vulnerable patients who are at highest risk after discharge, this really is the solution.
Readmissions are expensive for patients. Copays and deductibles add up with each hospital stay. And for hospitals,
readmissions cost our health system billions of dollars, and we need to free up beds for the next patients that are in need of our care.
The virtual clinic is available to patients at UCSD's Hillcrest and Jacobs Medical Centers, with plans to expand. Horman says it's a model that can improve health outcomes, cut costs, and give patients a safer path home. Heidi de Marco, KPBS News.